Hello and welcome to your 2022 Employee Benefits Summary. My name is Mary Feuerbach and I am from Michigan Planners. We are a third-generation family-owned employee benefits agency located throughout the state of Michigan. I am located locally here in Escanaba and happy to be working with you and AM Express. Today, Angela and I are going to go over your benefit offerings for 2022. This will be a high-level overview. If you have specific questions, my contact information is in the employee benefits summary that you should have in front of you. So today we are going to go through your 2022 employee benefits summary. And in this, you are going to see a number of pages. The first page is the table of contents. That is self-explanatory, so I'm going to flip it over. And the next page you are going to see is really commonly asked questions of why you should contact Michigan Planners. And so if you are having any problems with billing, there's something you get that isn't covered, you need help with a prior authorization for a service, there is a drug that is not covered, you had a baby and you need to get that baby added onto your insurance, or you just don't want to call and talk to one of the carriers for an hour and a half and then possibly get hung up on, give our office a call. There's two people listed in the booklet. The first is myself. I am located right in Escanaba. And the second is Shelby Ross. Shelby can help. She's really kind of a jack of all trades, but between the two of us, we are able to help with any of your questions. The next page is going to be the eligibility and cost page, and this is going to be the most important to you. This is going to lay out what your benefits cost per pay period, per paycheck for you. So what we're going to see in this book, for those of you that currently had coverage in 2021, you are going to see that for your base plans that are going to be offered on your medical, there are no price increases in premium. You are going to see your dental rates went down a little, slightly, and your vision rates stayed the same. In 2022, your medical insurance is going to be offered through United Healthcare. There are going to be 4 plan offerings that you have, and each of those plan offerings is with the PPO network. The 4 plans that you're going to be offered are going to be a base plan, and then you'll be able to buy up to additional coverages for some additional premium. The base plan that you're going to be offered is the $45 plan per week as an individual. That $45 plan a week gets you a deductible of $3,000 for a single, $6,000 for a family. After the deductible, you'll have a coinsurance. That coinsurance is 80%, 20%. What that means is that United Healthcare, once you've met your deductible, will pay 80% with you paying 20%. That 20% for you is capped at the out-of-pocket max on the plan of $6,350 for a single, or double that, $12,700 for a family. So your next plan option you have is the $55 plan for an individual, and that $55 plan has a deductible of $2,000 for an individual, $4,000 for a family. After you've met your deductible, you're going to have a coinsurance of actually 0%, with United Healthcare paying 100%. The out-of-pocket max for this plan is $4,000 for an individual, $8,000 for a family. Your fixed copays on this plan are going to be $30 for an office visit, $60 for a specialty doctor, $350 for emergency room, and $75 for urgent care. Your $60 a week plan for an individual includes a deductible of $1,000 for a single, $2,000 for a family. After you've met that deductible, you have a coinsurance. United Healthcare will cover 90% of costs. You pay 10% of costs. Those 10% of costs are capped at the out-of-pocket max on the plan. The out-of-pocket max on the $60 a week plan is $3,000 for a single, $6,000 for a family. Because you've already paid your deductible of $1,000 for a single or $2,000 of family, the max you would pay in coinsurance then would be $2,000 for a single or $4,000 for a family. This plan has fixed copays of $20 for an office visit, $40 for a specialty visit. Otherwise, it will have the standard emergency room visit of $350, $75 for urgent care. Your last plan you can choose from is the $67 a week plan. The $67 a week plan for a single has out-of-pocket costs for a deductible of $0, and your coinsurance is 100% coverage with you paying 0%. The out-of-pocket max on this plan is $1,250 for a single and $2,500 for a family. This plan also has fixed copays for emergency room visits of $350 and urgent care visits of $75. Your prescription drug plan with United Healthcare includes a 4-tier prescription drug program. Those tiers are made up of generics, which would cost you $5 per prescription. Otherwise, the cost of the prescription, if it's less than $5. For brand name, it includes a fixed copay of $40. Then you're getting into your tier 3 and 4, which are non-preferred and preferred specialty drugs. And those could be your tier 3 have a max cost of $105, or your tier 4 drugs, which are $250. There is a specialty tier 4 drug copay up to $500. Please note that for each of these drugs, they do go towards the out-of-pocket max on the plan. Just note that depending on the cost of the drug, there are websites out there like goodrx.com that you can go to that might have coupons or lower the cost of the drug when you go to the pharmacy. In addition, that sometimes drug manufacturers, if you just frankly Google the drug, that a lot of times there are copay assistant cards that you can print off, and it will take the cost of that drug down significantly. If you have questions about what tier your prescription drug might fall into, note that in HR they have a pretty comprehensive list from United Healthcare that shows what tier each of those prescription drugs might fall into. Otherwise, contact us at Michigan Planners to help. Your dental benefits are going to be offered through Delta Dental in 2022. For each person enrolled on the dental plan, you have a plan maximum each year, an annual maximum of $1,500. That $1,500 can be spent in your preventative services, basic services, and major services. And the way that $1,500 breaks out is for those preventative services. Those are covered 100% twice per year, per calendar year. 100% no out of pocket to you. There is no deductible with that. Your basic services are covered 80% with you paying 20%. Note with that, those are that goes to the annual maximum of $1,500. Your major services are covered 50% up to that $1,500. There are some high costing procedures that generally when you have, those really wipe out that $1,500. Your vision coverage is through iMed. iMed is a national network of optometrists. For your vision insurance, you have coverage where you can go see an eye doctor once every 12 months. You can get frames once every 12 months, and you can get new lenses once every 12 months. For your contacts, you have once every 12 months, you can fill contacts up to $130. For frames, if you get glasses instead of contacts, you have a frame allowance of $130. Anything above $130 frame allowance, you get 20% off. For your exam, once every 12 months, you have a $10 office copay for that eye exam. For lenses, you have coverage once every 12 months, 100% coverage minus a $15 material copay. Know that for that 100% coverage, that is really for the base lens. If you want to have any lens enhancement, there are additional copays and out-of-pocket costs. please refer to the guidebook for those enhancement costs. When you're shopping for glasses, note that it's kind of similar to buying a car. You have your, base standard, and then you have these enhancements. So know that under your iMed plan, you have 100% coverage minus your $15 material copay for lenses. And then note you're going to pay some additional enhancement charges. So when you're going to your optometrist and you're picking out a pair of glasses, ask them what coverage you have and what each enhancement is going to cost you before looking to decide. So kind of similar to a car, you're going to buy that base car, and then you're going to upgrade to maybe leather, a moonroof, kind of the Midwest protection package. Think of that very similar when you're looking to purchase a pair of glasses. There are certain things that generally are included when you are buying a pair of glasses, such as scratch-resistant coating. Most lenses come with a standard warranty, regardless if you buy the scratch protection. So just double check and ask that your optometrist what those costs would be and what type of warranty you have on your glasses before deciding to purchase additional coverage. One new and exciting benefit that AM Express is very proud to offer to all full-time employees in 2022 is company-sponsored life insurance. Each employee, regardless if they enroll in medical, will be automatically then enrolled after the applicable waiting period in company-sponsored life insurance with the Guardian. That amount that AM Express is purchasing for each employee is $25,000 for life insurance and $25,000 for accidental death. So what that means is that if you were to unfortunately pass away and that was of natural causes or a medical condition, your beneficiary you have listed on your form would receive $25,000. However, if you were to pass away and on your death certificate it was listed as an accidental death, there would be double that coverage, and instead of $25,000 to your beneficiary, it would be $50,000. In addition to the company-sponsored life insurance, AM Express is very proud to be able to offer voluntary products in 2022, including voluntary life insurance for you, the employee, also life insurance for your spouse, and life insurance for your dependents. More information as it relates to costs and coverage can be found in the booklet. Otherwise, give me a call if you have questions on that. Besides offering voluntary life insurance, you also have the option this year of enrolling in voluntary short-term disability or voluntary long-term disability. Rates and coverages can be found in the booklet, or give Michigan Planners a call. Additional voluntary products that you have that you can choose from include voluntary hospital indemnity with the Guardian. And besides that, there's another carrier out there called Wellfleet. Wellfleet offers two products you can enroll in, either critical illness or accident. More information about those can be found in your employee benefit booklets. Otherwise, feel free to reach out to us at Michigan Planners.
Okay, so there is 8 pages of the form that needs to be filled out.
Yeah. Oh, yeah. Let's go through. So section 1 is going to be your information as the employee. So, of course, your name, your social security number, your date of birth, your address. When you're filling this form out, if you can try and make it as legible as possible, only because somebody else is going to be inputting this information into websites, and we want to make sure that your 7 isn't actually a 1. So just really make sure if you could fill it out really with your best handwriting. So for coordination of benefit information, if you or anybody else you are looking to enroll on your health plan has other coverage, this is where you're going to place that information. So if you are enrolling your spouse and your spouse has other insurance, if you are enrolled in Medicare or Medicaid or have VA benefits, this is going to be the place you're going to place that. So on page 2, it's going to be listed of enrollment or change of status information, and this is where you're going to place the information of any and all dependents you're looking to enroll on your plan. For that, you are going to want to put the name of each individual as well as their date of birth and social security number. So then you're going to get to your election choices. So section 1 is going to be your medical information. You are going to see those listed first with that $45 plan, which is that $3,000 deductible plan. And then you're going to go over then to the second choice, third choice, and the fourth choice of either single, two-person, or family. Employee-only coverage is if you are enrolling just yourself. Employee plus one can be you are enrolling yourself plus a spouse or you plus a dependent. And family coverage is really 3 or more individuals on the plan to include yourself as one. It could be you plus 2 children. It could be you plus a spouse plus 1 child, or it could be you plus a spouse plus 4. So a family will be anything 3 or more. For the medical insurance, if you are not taking medical but enrolling in additional benefits, still just fill out the form and fill out that you are waiving your medical coverage. And note that if you and your spouse both work for AM Express, you can make your elections separately. You don't have to enroll as an employee plus one. You can enroll as 2 singles or 2 employees only for coverage. Section 2 is going to be your dental benefit, and what you're going to see is going to be a little bit different than your medical premium, and that it's going to be a 4-tier. So it's going to be employee only, it's going to be employee plus spouse, it's going to be employee plus child or children, and then it's going to be family. So it's going to be dependent on your family situation and who you're looking to enroll in your dental. Note that just because you're enrolling somebody in your medical, you don't have to enroll that same individual in your dental or your vision for those other benefits and vice versa. So if you are looking to not enroll somebody in your medical, but you want to enroll them in your dental and vision, you can do that as well. Your Section 3 benefits are going to be your vision coverage, and those are going to run very similar to your dental. You again are going to see a 4-tier premium. You're going to see the employee only. You are going to see employee plus spouse. You're going to see employee plus child or children. So if you have more than one child that you're looking to enroll with no spouse, or a family plan. For Section 4 is going to be your group term life. So that is your company-sponsored life insurance, that $25,000. So because every employee, every full-time employee at AM Express is automatically enrolled in this life insurance, we need to be able to collect your beneficiary information. So this section is going to be where you're going to fill out your primary beneficiary and then your contingent. So what that means is your primary beneficiary is going to be if something happened to you, who would you want to get that money? You can list more than one individual. There is a section for 2. If you want to have more than 2, just attach a second page with who you would like for that those primary beneficiaries. And note that for the percent then, you can place something like split equally at death, or if you wanted to have different percentage points. So you want your primary to have 50%, and then you have 3 other primaries listed that you want to have those have a different percent, you can do that. For your primary beneficiary, if something happens to both you and your primary beneficiaries at the same time, then you can list a contingent beneficiary. So for an example, if you are listing for your primary beneficiary of your spouse, and then your contingent beneficiary, you want to be able to list a sibling, a parent, a child, you are able to do that. And similar to the primary beneficiaries for contingent, if you have more than 2 you'd like to list, just attach a second page. Once you get into the other sections, including Section 6, Section 7, Section 8, you are going to get into the voluntary offerings. So you are going to fill out each section if you want to enroll in that voluntary coverage or if you don't want to enroll in that coverage. Note for some of these you aren't going to see the premium rates associated because it is a pretty comprehensive list of how to figure out what that premium is going to be. And there's an additional packet each of you will have that will include a worksheet on how you're going to figure out that premium amount. Otherwise, if you do have questions, please reach out to me and I'll be able to help assist. So your Section 9 and Section 10 are going to be your voluntary benefit offerings with Wellfleet. So that's going to be your accident and your critical illness. Any questions on enrollment related to that, feel free to reach out to me. You will see on the very last page, Section 11 is going to be asking you to total each of your prior elections and then being able to sign the bottom for that employee signature and dating it. If in any of this information you have any questions, feel free just to reach out to me. You can reach me by email, either maryf@miplanners.com, or my phone number, my office line, 906-261-0101, or my cell is 906-553-2677. Otherwise, thank you so much for going through benefits with us today, and thanks.